everybody. It's Becky Pearson, joined with my co-host Destry Millsap on Pivot Point of View. And today we have the great honor of talking to Dr. Zulia Frost, and we're going to dive into her innovative approach to healing the body. So, welcome to the podcast, Dr. Zulia. How are you today?
Thank you so much, Becky. Thank you for inviting me. And oh, I am really excited to share with my knowledge because I've learned a lot since I start pioneering this form of therapy.
Cool. So let's give a little bit of your background to our listeners so they get an understanding of who you are, where you came from, and then we'll dive into the journey that brought you to this point.
Gosh, I don't know where to start with because I've done so much in my life. I started as a medical doctor and I treated my patients were children, so then I started to treat adults as well. Then I've always been attracted to technology and I work as an ultrasound specialist for diagnostics some period of my life. And then I end up working with a variety of technologies in the field of bioresonance. Uh, it's just life takes you on unexpected journey. In this part of journey, I learn a lot about light therapy using lasers, using LEDs, and also a question about the I question about the energy concept. So the latter part of my life is became to study energy concepts, particularly traditional Chinese medicine, acupuncture. I wanted to know how it's all related. So, in a sense, what you get today is a person who understands human body so at 360 degrees, because I can speak as a medical doctor, but also as a alternative medical practitioner and the person who understands a little bit about the energy therapeutic approach.
Yeah. So combining both Western and Chinese, Eastern Western, I guess would be how it would be considered. Have you found that you've been able to bring out the best of both worlds in having a background in both?
Absolutely. In my view, it always was a holistic approach. Even when I work as a medical doctor, I always wanted to understand what is the cause, because the cause for your disease could be not where you feel your pain or manifestation of symptoms. So this sort of holistic concept always been there with me, but I certainly expanded with understanding of the roots and energetic connections in the body. And all my life, I strive to give the best service to people and finding the actually fundamentally the root of disease in order to eliminate it.
Yeah. So tell me what brought you to the point where you wanted to recreate or create Recharge Health. Okay, is that your clinic? Is that the name of your clinic? Okay. And then what brought you to the part of innovating a wearable red light device?
Um, Again, it wasn't that simple.
But
It wasn't
not.
simple, yes. To start with, I tell you, I should really explain to you the fundamental drive because it's important in our conversation to understand it. So I was, as a young person, I was involved in a very, very serious car crash. I was basically broken so much, so I nearly died. And in my recovery, I suddenly found myself to be a patient and experiencing everything I learned to be a medical doctor, but from the other side, from a patient side. I designed all rehabilitation program myself, like from exercise. Of course, I was guided by a neurosurgeon and everybody who were helping me to recover. But in my discovery, I found that I cannot tolerate medication very well. So I was looking to sort of biophysical approach to healing, to recovering from injury. And I start looking into physics of the body. What I realize is that the energy aspect it has been overlooked, and you can fix the body using energy of light, energy of electricity or sound. And then so I invested lots of my life to study these disciplines, to understand how you can influence the body and induce that healing um aspects, but also create a healing environment for the body. Because if you, I mean, everybody now knows after surgery you have to move, because then you stimulate the blood flow. And once you stimulated the blood flow, then healing can be much, much more faster. But before, people didn't know about this. And with this kind of knowledge, I was looking for modalities which can make your blood to move faster, give more oxygen to the tissues, etc. So in my journey, I use lights. I use electricity to stimulate my body for healing. Uh, all sets of exercise I was doing. Also, nutritional aspect. You know, you want to heal, you need building blocks to create your healing. You need proteins, you need even sugar, but you need in a very sort of intelligent way to approach this whole process. And eventually I landed to in the concept, I created a clinical concept of using these modalities for healing. And I became super popular. I mean, I had patients coming from all over the world just because they heard that you can, first of all, recover from diseases, serious diseases. And second of all, is you can expedite your healing so fast using modalities. So I looked into concept of creating something which people can take home, because I see them once a week, maybe once in fortnights in the best scenario, and I give, of course, massive boost of energy in the body to expedite healing. But then people go home and nothing is happening. So I thought, if we have some kind of gadget, if you have something to take home, you can continue that healing journey, and so you even be faster in your healing. With this in mind, I looked for partners, and very soon I found like-minded people who we click so much. And we decided we're gonna set up a company. It's a company which makes these devices. Yes, so we call it Recharge Health. And why? Because that's what exactly we do. We're using light to recharge the body to start producing healing effects. And needless to say, that was a super, super exciting journey for me. And now it's been almost 7 years since we just conceived the idea. Sorry, conceived the idea. And now we have the modalities, we have devices, and people using it for at least 5 years. And every day I speak to people who use the light therapy device. This is called Flex Beam. And oh my God, I get so many interesting comments, and it certainly, certainly help people to heal. Yeah, not a
Yeah.
simple journey.
Destry, do you have anything?
Oh, no, we started using red light therapy and infrared therapy with our athletes, and it's just been such a great adjunct for them to help increase that healing process with their soft tissue injuries and post-surgical injuries. I mean, It's just been a very nice addition to what we do.
Yes, and you know, there is lots of scientific approach to this. It didn't come from just, you know, sticking finger and saying, "Oh, I'm just gonna do this." Yeah. Uh, in the creation of this modality, we went through lots of scientific papers. We understood which wavelengths of light actually can produce therapeutic effect, at which dose. You're absolutely right. You're probably familiar with the panels, red light therapy panels. They produce red, infrared, sometimes blue, green, other colors, but red and infrared, they're fundamental. And actually, it's for reason because red and infrared lights the safest. You cannot get any side effects from this. And this is the same light which comes from the sun. So people should be familiar that, you know, when you're in the sun, you feel fantastic, you feel energized, you feel well, and you just do a lot more with your life. And when you deprive from this sunlight or this particular wavelengths of spectrum sunlight, then you feel the opposite. You become susceptible to infection, you have no energy, no drive, and lots of people experience depression because of lack of sunshine. And in the northern hemisphere, people suffer with SAD disease, you know, like not enough lights for the body. So when we look in creating FlexBeam, we chose this particular light for its therapeutic property. But I think one aspect, again, from science point of view, you should know that this red and infrared lights target specifically mitochondria. This is the engine at the cellular level. This is the one which makes energy for every cell in your body. So if you're exposed to this light, you literally physically make much more energy. So you become energized. And that's what you're telling me that the athletes experience in this.
Mhm.
But I think I'd like to talk beyond the athletes because I think everyone should be using it.
Absolutely. I mean, the way that it can decrease inflammation, we see so many people with chronic disease anymore. And it's just just another way for people to give their bodies what they need and heal in a different way. What are some conditions that you've seen great benefit with the red light that are outside of the injury realm?
Yes, you're absolutely right. The inflammation. If you talk about, we all know we live in pandemic of inflammation. Everybody has got somewhere inflammation, but lots of people not really understanding that actually the body heals through inflammation.
Mhm.
So when you next time hear about inflammation, you should think immediately it's your body is trying, attempting to fix something. But when there is not enough fundamental energy in the body, it cannot progress to next stage and fix itself. So, and people stuck in inflammation and they keep going in this loop in inflammation and it's getting nowhere. So, if you give the body the energy, particularly right energy, you can finally resolve inflammatory conditions. Besides, there is a science also showing that when you shine red and infrared lights, you produce anti-inflammatory messengers. They call cytokines messengers, and they telling the body to stop being inflamed all the time. Yes, because the light itself can help to initiate healing, so you don't need to produce inflammatory response and produce, in fact, some cytokines which are anti-inflammatory by nature. So, if you talk about conditions arthritis, first of all. You know, osteoarthritis, almost everybody after a certain age, they have it. And joint disease, the inflammation of the bowels, you know, like stomach. Probably lots of people familiar with irritable bowel syndrome when your digestion isn't performed very well. Well, it doesn't matter what kind of inflammation. If you use lights, it can help as well. Then you, of course, can, beyond injury, you can address sleep. Like lots of people suffer with insomnia. And when you don't have a good sleep, what's happened to you next day? You can't perform, you can't function. I can't. I'm so sensitive to it. So you kind of like you're doing some work, but you can't have focus. You don't have much creativity. And we mentioned about emotional depression, which comes as a result of it. So when people don't sleep night after night after night, they're exhausted. They become disinterested in life and they become really unhappy. So knowing that you can use lights in a very simplistic way and repair that recovery cycle at night, it's really great because then you sleep and sleep actually normally because we've got people who wear Oura ring, for example. This is a little gadget which measures your sleep. Or people have nowadays apps where you can look at in your phone and say, "Oh, I got a lousy sleep last night." So you can verify that you sleep and your deep sleep is really good with red light. And so these conditions, because also sleep is linked with a hormone called melatonin. You probably heard of this. And melatonin is not just for sleep. Melatonin is a very interesting hormone because it regulates the whole circadian rhythm, day and night pattern. And every single hormone in the body is linked to the circadian rhythm. So if you have skewed body clock, your hormones overlap and then you can have like so many issues. And you go to see a doctor and doctor says, "I don't understand, you've got this, you know, your labs work show everything is fine, why are you ill, it's in your head," you know, and dismiss it often. But truly it could be because that circadian clock is not working. So when you start using red light on regular basis, it all goes back into sync. So I've seen recovery with this. I've seen the really, really fantastic results with women with menstrual cramps because this is happen in a certain time in the months, and they there is a lack of circulation of blood. And we already know that when you stimulate with red light, you enable blood to move much better. So if you put it over the pelvis, then you have, first of all, ease in pain, and then regulation of the female cycle. Um, I mean, you stop me because I can speak forever.
So, so what are some ways that people can apply red therapy to themselves? What is the correct way to receive red light therapy, and you know, how long should a person do it each session? What are some applications of red light therapy?
I would say begin with the goal, what you want to achieve. Yes, if you want to increase energy, there is one way. If you have an injury, it's completely different way. Yeah, application. So, and then what device you have. If you have panels, typically panels are used for kind of systemic effect, like overall feeling better, overall feeling stronger. With panels, you need to stand, preferably undressed, and you cover your eyes, and you stand for between 20 to 40 minutes every day, so you build it up. What I want to say today about the Flex Beam device, it's a really special one because this one you wear on the body. You can put it on the body. It has a little straps, so you can stick it to your lower back, for example, or you can put it behind your neck, yes? Or if there is a specific joint, you can wrap around the joint and you can continue doing whatever you do. It operates in about 10 minutes cycle. And then if you have a joint issue, you just then say, okay, I treated this joint, maybe I have associated tension in my neck, then I can put on the neck. So um, Flex beam specifically is typically used about 30 minutes a day, 20 to 30 minutes a day. And you're going to be using, if you are addressing the injury or specific joint, you just place it right there. Whenever you experience pain, stiffness, or even, you go to the gym, you overdone it, oh, my muscles are really sore. You can just place it right there and then. But if you want to optimize sleep, for example, there are specific positions in the body which can help you. We call them sort of vagus related positions. So where the vagus nerve goes through the body, so it's through the chest to the abdomen, and lots of vagus fibers around the neck. So you can put it around the neck like this. I actually design specific protocols. I call them protocols, a set of instructions, help our users to use what specific needs. I designed about over 80 different protocols for all sorts of individualities. So you have access when you use the device. But generally speaking, you can do as little as 10 minutes a day, as much as 1 hour a day. It's plenty. You can also prepare yourself for like running marathon or playing tournaments, something like major sport events. In fact, we've got our ambassadors. I'm so proud because these guys are top athletes, and they use Flex Beam and they endorse it not because somebody pays them, because they found when they use Flex Beam before they exercise, they don't get so tired and they don't get so many injury and they recover faster from fatigue.
So you can use the Flex Beam before or after. You can use it as a primer or as a recovery tool.
Exactly.
Good.
And it was very interesting. We discovered it by chance because I wanted to know when should we use, before or after. So we did a little study ourselves. And we found then even if you use before the game or tournament or marathon, you then, when you finish, you don't get fatigue or get very little of fatigue. That was astonishing discovery for me. So you almost prime the muscles. They become much more energized. They become like blood circulate much better. So you can actually perform better. This is my personal view.
Are there contraindications that there certain people that shouldn't use red light therapy?
They're very little because it's light. As I said before, it's coming in the same wavelengths from as it coming from the sunlight. It's of course more potent because it's just more concentrated lights. Uh, Generally speaking, I would mention three things which you should consider. Number one, uh, it's uh, people with cancers, they have to be careful. It's really interesting. Lately, science is very interesting because 50% of scientists, they say actually light help with cancer, but we still don't recommend to place on the tumor projection itself. We say place it elsewhere in the body to optimize the body function, but not where the tumor is, because it's not been 100% proven. And if any tiny little doubts, I would say better don't use it. Okay.
Mhm.
So second one, for ethical reason, of course, nobody doing studies on pregnant women. So we say don't place it on the pregnant uterus with women. However, you can maybe use it some, like if this pregnant woman has some knee injuries, maybe she'll be okay to use it, but the actual uterus we avoid. And the third might be a tricky one because so we say don't place it over tattoos. And I explained to you from physics of light, black surface, like dark surface, attracts the light to the surface. It doesn't allow you that even sunlight to get through inside. So it's kind of accumulating the surface. So it can get hot. Okay, so it's the same way like you wearing a black t-shirt on the beach and you feel hot. Yes, wear the black because the all energy instead of getting inside your body is surface. So we tell people with tattoos avoid placing on the tattoo itself. You can place around this, and light still going to have positive effects. But even with tattoos, not every tattoo reactive. I had one guy like completely covered with tattoos, and he's doing 1 hour every day and absolutely no problem at all. And then I had a girl, she had just very recent tattoo on the ankle, tiny little tattoo, like this centimeter size. And she got a little tiny blister. And I'm like, where did this come from? I think it's depend on the kind of ink is used in the tattoo. But of course, for safety, we tell our users not to place it over tattoos. I mean, all the rest is common sense. And some people could be too sensitive to light and very easy to test. I would say if you feel heat underneath the device, then don't place it there or place it shorter, 5 minutes instead of 10 minutes. But so far, in these 5-7 years, we tested the device, and there was literally nothing alien came through all the people, and we have now over 50,000 users, so
Mm,
it's very
wonderful.
safe, very safe. Yeah.
So are there different frequencies of the red light? Like, because I will get the question a lot when I'm working on someone's horse is, with the modalities that I use, they'll ask me, well, should I have a red light device? Should I use this on my horse? And how much and all that kind of stuff. And so if I usually don't really address that because I don't know their device. I'm not really familiar with that. But are there different frequencies for intensities? Are there different frequencies that penetrate deeper than others? And does your device have different frequencies for different settings, like let's say more of an acute injury versus a chronic injury? Would you use different settings for that or just different amounts of time? How would you manage that?
Yes, Becky, really, really good question because first of all, depending on the device you use, you need to always to look at the manual because manufacturer should give you guidance how their specific device to be used.
Mhm,
And you're absolutely right. It's everything about the dose.
mhm,
Dose is basically consists of three elements: how strong the light source, how far is it from from you or from horse is that? Because it's further away, it's become weaker, 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 yes. And the third, how long is in skin contact or stimulation? So typically, a manufacturer should tell you what is the dose and how often should be used, but sometimes they don't. And I've seen people coming back to me and saying, "Oh, I don't know how to use." There are formulas you can calculate, so I calculate for other people, but well, really with Flex Beam, it's really straightforward because flex beam is designed always for 10 minutes, yes, and we know the strengths, and because they're just LEDs, they're not lasers, they're very safe, yes. So, and we know how strong they are, and we know they always in skin contact, whether it's a human or animal, it doesn't matter, it's produces the dose. Effective dose is very important to get result. If you produce not enough stimulation, you don't get results. If it's too much, you can override and also not get results because it's too much. So having sweet spot is very important. Uh, and you also mentioned acute or chronic. It's really important. You absolutely agree with you. So what happened with acute situation? With acute injury, let's say, you have tremendous demand for energy. So the body really trying to source energy. That's why you probably notice if you hit the shoulder, you start oh rubbing like this. Why? Because when you friction doing friction with your body, you generating that energy there. Yes, so when you have acute trauma or injury or even inflammation, you need lots of energy. That's why we recommend to use the device two, even sometimes three times a day, but over the area which hurts. You don't need to invent and create something, just there, 10, 20 minutes, and then again, repeat one more time, and that is enough, yes. And then you do it day by day, and you know your healing is like a rocket in the sky. But if people have chronic injuries, it's really depend. Lots of especially elderly people, they have many coexisting chronic problems, and they also take medication which also drain the energy reserves out of the body, because you need to break it down and you need to eliminate, so everything is requires energy. So for chronically ill people, we recommend to use it once a day, or for some really sensitive, really like frail, every other day. Yes. And then you place it where you feel the symptom. Let's say neuropathies, yes, on the feet, yes. So you're just gonna put it on the feet. But put it on the feet is not enough, because very often neuropathy comes from the compression on the nerve in your low back. So you'll see in my recommendation to put it also on the low back. And very often, low back is a result of the poor neck because it's compensate, yes. So there is a compensation. So maybe you need to put on the neck. So about, I'd say, 3, 4 placement in one day, in one go, for chronic complicated issues. And then every day or every other day. And if you do every day, I also recommend to break it, like have a like weekend off if you're doing the whole week, or at least Sunday off, because when body receives energy, it immediately puts it into work. It just, stimulates all the processes. So if you put too much energy, you can literally overdose the body, and the body will say, oh my God, I can't integrate this. And so it goes into healing crisis. Although with flex beam, I don't see much of this. Maybe because we always ask to 5 days on, 2 days off, or 6 days on, 1 day off. We don't see much of it. It's pretty consistently good. And you probably see results with arthritis. I'd say you need about a couple of months consistent use. With neuropathies, about 3-4 months. But you already know after 1 month it's on the right track. Yeah.
So if somebody is interested in your device and they would like more information, where would they find that?
We have the website. It's really straightforward. It's called recharge.health. That's it. Nothing else. No com, nothing. Recharge.health.
Okay.
Yes.
All right. And I would imagine you probably don't get this very often, but they could probably use it on themselves and their animals, like a dog or a horse or something like that. Okay.
Yes, yes, for sure. I know this because we created for people who use FlexBeam. We created for them a platform where they come like a forum and they talk to each other.
Mm.
And lots of people come and say, "Oh, I have a dog who's sick and poorly. Anybody knows what to do?" And I can read the conversation. And yes, dogs, cats, small animals, they like children. They require less stimulation. So normally we tell them to use half of the cycle. So instead of 10 minutes, they're gonna get 5 minutes.
Mhm.
But horses, uh, despite they're bigger animals, maybe need bigger placements, but they're also very sensitive. And
Mhm.
fur is not interfering. Fur, it's actually extension of this nervous system. So same 10 minutes for each position. I have actually somebody who wrote a PhD on using on horses specifically to calm them down and help them to reduce that, you know, we call in medicine sympathetic drive. Like, so HRV, they measured HRV of horses and they showed that HRV gone much better after just a few sessions of using flex beam. Yes, so animals are really, really nice. They're sensitive and they know when is enough. When is enough, they just start moving. But very often we've seen with cats, especially, you put this like an arch, and the cat is lying sort of underneath, and they come in into this arch. They lie there 1 to 5 minutes, and then they get up and go. It's almost like they know what is ideal for them.
Mhm. Mhm. Now, let's say somebody just had surgery and they're interested in this to help their recovery, but maybe they don't want to buy one. Do you have rental options? Do you care to talk about the pricing at all?
Yeah, I can explain that. We don't have rental, no, but there is a 60-day money back guarantee. So people can take it, evaluate it, and if they like it, they would keep it, or if they don't like it, they can return it. It's no question asked. And we're doing it because we're so confident, because people, when they start using it, they love it. And all members of the family start using it for, there are lots of things to be addressing it. So
Mhm.
the device also, we kept it in the sort of affordable rate, I'd say, because for what it does, it could be thousand and more, but it's a price $550,
Wow.
and that is, we made the conscious choice to make it available for people. So again, you can buy it, evaluate it, and you don't like it, you can return it. We very confident you like it.
Yeah, and that honestly, that price does surprise me because it does sound a lot more reasonable than a lot of the other devices that I've looked at. So that's wonderful to hear.
I love red light therapy. I think there's a lot of good benefits that have been overlooked. And so I'm glad that we had this conversation today.
Yeah.
Well, thank you for your openness and kindness, because for me personally, I think this is to be a medicine of the future. Because if we can use modalities that are safe, they don't have side effects, they easy, and it's actually, it doesn't give you any pain, any uncomfortable, discomfortable sort of sensation. But fundamentally, I think everybody should look into this kind of new wave of therapy or therapeutics, because we need to take responsibility for our health back in our hands. We cannot keep saying, my health. I had once a patient who came to me and he said, I am an antique story dealer, and I have this broken chair, and people come to me and say, fix it. And he said, I'll have broken health, fix me. I said, no, it doesn't work like this. It's your responsibility. I'm here to help and give you guidance and modality, and you're gonna fix yourself. So having own control of your own health is so important, and it just empowers you to take charge of yourself, and you become much healthier, much more integrated into society being. But also for your horses, because I know you talk about riding horses, and how important for you to have them healthy and well. This is an extra tool which get them well.
I agree. I think that people get hung up on there being some sort of magical pill, magical, drug or whatever to help get them better. But health is a journey, and it's every choice that you make every day, and the things that you do for your body, you put in your body. It's more of a journey and not just a destination. And so you're right. People have to take responsibility and hold themselves accountable for their health, and you can't give up. You can't just say, well, I'm old now, so this is how it is, or oh, I had this injury, so this is how it's always going to be. I mean, that's exactly why Becky and I do what we do. That's our philosophy. And our patients have to believe that it's possible. And so whatever is out there to be able to help them. You can't, just because one thing doesn't work, you can't just give up and be like, oh, I'm never going to get better because that one technique didn't work. No, we're going to find a different technique, a different modality, a different supplement, whatever it takes for the body to heal itself. God put everything on this earth for us to be able to heal ourselves. And with the red light's no different. You said it comes from the sun. I mean, we've already had it put on this earth to heal ourselves.
Yeah. No, thank you so much. I see how dedicated to your journey, both Destry and Rebecca. So I am really grateful you gave me a stage to speak to, because I speak my truth.
Yes, ma'am. Thank you very much for coming on here and doing that. All right. Well, if everybody doesn't have anything else, I'll close this out. And thank you so much for being on here. We really, really appreciate you coming and sharing your experience, your philosophy, the flex beam. It all sounds great. If you want to get a flex beam, check out the website recharge.health, and or reach out to us and we can help get you hooked up. Thank you all again for listening, and let your health be the pivot point to your success.